So we talk a lot about some of the common presentations of CLL and SLL. Of course, we talk a lot about the treatment options and what we consider more common way of treating CLL, the expected side effects, namely infections and cytopenias and things like that. But I think in practice, we all encounter cases that are less common, but really at the same time are important to think about them. And in practice, we all understand that, you know, once you get used to seeing the more common issues, you sometimes kind of let your focus be on the more common problems and may potentially miss some of the important but rare presentations or complications. So we have this session that we'll talk about some of the less common presentations or complications. And for example, I'll be discussing an interesting case of a patient with a CLL diagnosis who developed an acquired von Willebrand syndrome that was successfully treated. I think it gives some awareness about thinking about some of these rare complications and also sharing our experience in terms of what treatments may be more effective.